In this video, we will continue our discussion on the characteristics of neoplasms and cancers. And in this video, we'll talk about the characteristics of benign and malignant neoplasms. And we'll start with the question, how do I tell benign and malignant neoplasms apart? And that's what we're going to discuss. There are four fundamental features by which you can tell benign and malignant tumors apart. The first is differentiation and anaplasia. The second is how fast they grow. Number 3 is local invasion. How invasive are they? And number 4, metastasis. Certain features may indicate innocence or benign, and others may indicate malignancy. So first we talk about differentiation and anaplasia. So differentiation and anaplasia refer only to the parenchymal cells, the functional part of an organ, or the cell type or functional part of a neoplasm. The differentiation of parenchymal cells refer to the extent to which they resemble their normal forebear morphologically and functionally. So differentiation is this concept, and sometimes it's hard to grasp, and we'll try to explain it the best we can, but it's how well differentiation means how well these neoplastic cells in the parenchyma mimic or look like their normal forebears morphologically, so how they look like under a microscope, and how do they act. So you have a mother cell that gives rise to two daughter cells. Okay, so then in real life, how well do children look like their parents? So that's what differentiation is how well the daughter cells look like and act like the mother cell. If they act like the mother cell, then they're fully differentiated. If they don't, then they lack differentiation, and we'll talk about this. So benign neoplasms, they're composed of well-differentiated cells that closely resemble their normal counterparts. So benign neoplasms, the daughter cells look morphologically and they act like the mother cell, so they're fully differentiated, or they're well differentiated. A lipoma is made up of mature fat cells with cytoplasmic lipid vacuoles. Benign tumor of cartilage, a chondroma, is made up of mature cartilage cells that synthesize their usual cartilaginous matrix. This is evidence of morphological and functionally differentiation. In well-differentiated benign tumors, mitoses are extremely scant, which means rare, in number and are of normal configuration. So there's not a lot of mitoses, and they're of normal configuration. They look like their mother cells. In order for a baby to look like her dad or her mom, in this example in this picture, there's steps. Step 1, step 2, step 3, step 4. You have to go through, toddler stage, child state, adolescence, adulthood, and then you can look more like your parent that is an adult. There's steps. So how many steps this child takes, or this daughter cell takes, depends on how differentiated she becomes, or this daughter cell becomes. So there is a continuum. There's a continuum of not looking not alike and well differentiated, a lot alike. There's a continuum here, and it's becoming more like your parents. There's a continuum. You have to, through time, you can become more like your parents as you age and mature. Well, in mother cells and daughter cells, and in cancers, how well do the daughter cells, or the cells that got replicated, look like the mother cell? In benign neoplasms, they're differentiated. They look a lot like the mother cell. So malignant neoplasms are characterized by a wide range of parenchymal cell differentiation, from well differentiated to completely undifferentiated. So here's that continuum again. Undifferentiated clear up to well differentiated. So benign neoplasms kind of sit in this camp of well differentiated, but malignant neoplasms, they can range the whole spectrum. They can be they can be not a lot like their parent, or they can be a lot like their parent cell. Between the two extremes lies tumors loosely referred to as moderately well differentiated. So if a tumor is, it has some characteristics of the progenitor cell or the liver cell it came from, but there's a lot of differences. Well, then that you would classify that as moderately well differentiated. The better the differentiation of the cell, the more completely it retains the function of the normal counterparts. So that's a key component there, because if a cell is well differentiated, or it looks a lot like and acts a lot like the cell from whence it came, then the function remains the same. So benign neoplasms and even well differentiated malignant cancers of endocrine glands frequently elaborate the hormones characteristic of their origin. So if you have a benign neoplasm in the thyroid, for example, you just might have more thyroid hormones. Okay? But if you have an undifferentiated cancer of the thyroid gland, you might have just weird hormones. You might have prolactin. You might have acetylcholine or epinephrine or some different hormone being secreted from the thyroid gland, because the undifferentiated cells, cancer cells, they're acting nothing like the cell from whence it came. Example, well-differentiated squamous cell carcinomas. So this is a carcinoma. This is a malignant cancer of an epithelium, and in this case it's a squamous cell. Looks like just little flat cells stacked up. So a well-differentiated squamous cell carcinoma elaborates keratin. Okay, that's kind of the skin cell from whence it came, produces keratin. A well-differentiated hepatocellular carcinoma elaborates bile. So you got some gallbladder cell that is secreting bile. Well, that's what it's supposed to do. So you classify it as well-differentiated. So here we have a well-differentiated squamous cell carcinoma of the skin. The tumor cells are strikingly similar to the normal squamous cell epithelium, and with cellular bridges and nests of keratin pearls. So you can see here that all these cells, they're flat, and then you might be thinking, well, if they look like the normal cells, how do you know it's cancer then? I mean, if I have a cell over here, if I have another one of these over here, and I have these cells lining this, and they're well differentiated, and they look and act like their parent cell, well, how do I know this is cancer? Why couldn't this just be another one of these? Well, there's just more of them. And so remember we talked about how cancers, there's more of the original cell. Well, then there would be less of these around. Does that make sense? I hope it does. So the stroma carrying the blood supply, so remember that the parenchyma is the middle or functional part of or cancerous part of the neoplasm, and the stroma is the supporting structures of the cancer. So the stroma that carries the blood supply is crucial to the growth of the tumors, but it does not aid in the separation of benign and malignant ones. So you can't differentiate between a malignant and a benign tumor by its blood supply. The amount of stromal connective tissue does, however, determine the consistency of the neoplasm. So certain cancers have a dense, abundant fibrous stroma that's called desmoplasia, making them hard, so they call them scirrhous tumors. Okay, so now let's talk about anaplasia or anaplastic. We talked about differentiation. Now let's talk about anaplasia. So undifferentiated cells are said to be anaplastic. So anaplasia, you have to think malignant. If there is a cell type or a tumor that's described as anaplastic, you know it's a malignant neoplasm. So what is anaplasia? It is a lack of differentiation, or anaplasia. That's what anaplasia means, is there's a lack of differentiation. And what happens, the result of that is you get unanticipated functions. So like I said, a thyroid tumor, a malignant tumor in a thyroid gland might produce just bizarre, weird hormones rather than just normal thyroid hormones. So for an example, some adult cancers produce fetal proteins. Now that's bizarre. These adult cancers that produce fetal proteins, you describe them as lack of differentiation or anaplastic. Others of non-endocrine origin produce so-called ectopic hormones. For example, certain lung carcinomas produce adrenocorticotropic hormone, ACTH. They produce parathyroid-like hormones. Other cancers in the lung, they can produce insulin, glucagon, and other hormones. And so those are unanticipated events, and all these cancers would be described as lack of differentiation or anaplastic. So the more rapidly growing and the more anaplastic a tumor, the less likely it is to have specialized functional activity. So if a cell, and we'll talk about this with the rate of growth, but if a cell here, divides and is producing more cancer cells, the faster this process happens, these cells don't have time to differentiate. They are just then, right after they divide. So they lose their functionality, and so that's anaplastic or undifferentiated cells. So lack of differentiation, or also known as anaplasia, is considered the hallmark of malignancy. We have to remember that. The term anaplasia literally means to form backwards. And this might be a confusing concept, but we'll talk about that in a minute. It implies de-differentiation. So it means going backwards in the differentiation pathways, or loss of structural or functional differentiation from normal cells. So what about stem cells of cancers, of malignant cancers, and differentiation? Stem cells are already like the original cell. What's the relationship between that? Well, let's talk about it. So here is a stem cell, okay? And according to different growth factors or different needs of the body, this stem cell will give rise to, and this is only hematopoiesis, these are only blood cells, but you could talk about this about any cell type in the body. You have original stem cell, and the stem cell will then go down certain pathways to give rise to the needed cells. Okay, so this multipotential hemopoietic stem cell, this hemocystoblast, gives rise to this common myeloid progenitor. Then this cell gives rise to the megakaryocytes, erythrocytes, mast cells, myoblasts. This myoblast then gives rise to the white blood cells, and this monocyte diapedesis out of the blood and gives rise to the macrophage. Okay, so let's say there is a cancer of macrophages. I don't know no one off the top of my head, but let's just say there was. So this part of the picture would be classified. So if this macrophage had a cancer and it divided and it gave rise to two more cells that looked like the macrophage, then you would say this is a well or a lot of or well differentiation. So you would say this might be classified as a benign tumor, okay? Because benign tumors are almost always well differentiated. Malignant neoplasms, however, remember they span this whole continuum from undifferentiated to a lot of differentiation. So lack of differentiation or anaplasia or dedifferentiation, those terms all mean the same thing. So let's say this macrophagia gives rise and divides, and it looks exactly like this hemopotential hematopoietic stem cell. Okay? It looks exactly like this, and it came from a macrophage. So in a tissue where there's tons of macrophages, and then you see all these hemocystoblasts, you would be thinking, oh, this is an anaplastic tumor. This is a lack of differentiation. They're not differentiating, or they're dedifferentiating, which means to form backwards. This macrophage gave rise to this stem cell that looks, and you'd be thinking, well, that's going backwards down the differentiation pathways, because these are differentiation pathways. These cells start here, gives rise to all these other cells. This is a differentiation pathway. So you're dedifferentiation. You're going back up this pathway. That's what malignant neoplasms can do, mostly because of the rate of growth, how fast they're dividing. Or they could give, let's say, this plasma cell. Okay, say you have plasma cells, and they split into two, and the cells start looking like natural killer cells. They got these dots here. So they start looking like these killer cells. Well, remember, malignant neoplasms, they can run the whole gamut, the whole continuum, from no differentiation to a lot of differentiation. So they're actually moving backwards. They're de-differentiating. They're going backwards up these differentiation pathways. So they're anaplastic. They're lack of differentiation. They're going backwards, de-differentiation. So you might be thinking, well, this is actually not a benign tumor. This is a malignant neoplasm because it's going back. And remember, these are just blood cell types. So this might be leukemias and different things, but every cell comes from a stem cell. And so if they go back the differentiation pathway to look more like this stem cell from whence they came originally, then it's dedifferentiation. If they divide and they look a lot like the cell that they came from, if they look a lot like the parent cell, the daughter cells, then there's a lot or well differentiation, and that's indicative usually of benign tumors. But remember that malignant neoplasms can look like the whole gamut, run the whole continuum. So anaplastic cells are pleomorphic, so there's marked variation in size and shape. That's what pleomorphic means, is marked variation in size and shape. Those are anaplastic cells. The anaplastic cells, their nuclei are extremely hyperchromic, which means they're darkly stained and they're large. Anaplastic cells, their nuclear to cytoplasmic ratio may approach 1:1. Now, what is this nuclear to cytoplasmic ratio? If I have a cell here, and then I have the nucleus, this nucleus is a three-dimensional shape, so it takes up a certain volume inside the cell. So normal nuclear to cytoplasmic ratio is 1:4 or 1:6. So the nucleus takes up 1/4 of or 1/6 of the total volume of the cell. That's normal. So in these anaplastic cells, the nucleus might take up 1:1. So a 1:1, so this is 1:4 or 1:6. That's normal. An anaplastic cell might be more looking like this. So the nucleus is the whole cell. It takes up all of the cytoplasm space. So This is indicative because all this DNA is getting transcribed and translated, and it needs a lot of space to do that. If it's all unwound at one time, it needs a lot of space to do that. So the functionality, well, there's no functional proteins in here. There's no ER, there's no Golgi, there's nothing in here. So it doesn't really do anything. It just replicates. And so you get a big nucleus. And so the nuclear to cytoplasmic ratio might approach 1 to 1 or 1 to 2 instead of 1 to 4 or 1 to 6. Anaplastic cells, they might have giant cells in neighboring them. And what are giant cells? Giant cells are where monocytes and macrophages, or any cell from that lineage, fuse together. And they form this big giant cell. And we'll see a picture of that in a minute. So they might form. Anaplastic nuclei are variable and bizarre in size and shape. They look weird. Instead of a normal circle, they might be like this, or they might be like this. That might be a nucleus, or that might be a nucleus, when they're supposed to look just normal round spheres. Mitoses are often numerous and distinctly atypical. Mitoses are just cells caught in the mitosis phase of division. Mitotic spindles may appear as tripolar or quadrupolar. So remember, you can see like a chromosome. Chromosomes you can just see because all the DNA, these spindles are getting ready to kind of pull these chromosomes apart into their daughter cells. And so mitotic spindles might appear rather than just bipolar, there might be tripolar or quadrupolar. So instead of 1 and 2 points, there might be 3 points. So it might be all scawampus, and we'll show you a picture of that. Anaplastic cells usually fail to develop recognizable patterns of orientation towards one another. So they're just kind of all over. You know, if all the cells are, let's say, columnar epithelium, all the cells are big columns. Well, this might be a normal epithelium. Well, then now the cells are going to be like this. So that might be indicative of anaplastic cells or a malignant neoplasm. They may grow in sheets and lose, community structures such as a gland formation or stratified squamous architecture. They might lose their architecture. So here is an anaplastic tumor of a skeletal muscle. This is a rhabdomyosarcoma, striated muscle malignant tumor. Note the marked cellular and nuclear polymorphism. Remember what polymorphism is? It's marked variation in size and shape. Hyperchromatin or dark staining nuclei and tumor giant cells. I sure hope you can see this cell. This is a giant cell. I sure hope you can see this cell. This is a giant cell. And look at this cell. Remember that nuclear to cytoplasmic ratio? That is a huge nucleus compared to the cell. Okay, now look at this one. This is getting bigger. See these dark staining nuclei here? Dark staining nuclei here. That's hyperchromatin nuclei. Polymorphism. Look at this cell. This nucleus is not round. It's kind of weird looking. Then they got these little nuclei all over. They got these bigger nuclei all over. So this is an anaplastic tumor of the skeletal muscle. This is what rhabdomyosarcomas look like. This is an anaplastic tumor that shows cellular and nuclear variation in size, so pleomorphic. And the prominent cell in the center of the field is an abnormal tripolar spindle, this is pretty cool. So we got 1, 2, 3. So we got 3 poles on one of those mitotic spindles. So that is indicative of a malignant cancer. And look at this cell. This cell nucleus here is different than this cell nucleus, which is different than this cell nucleus. They're supposed to be round, not looking like that. And then you got this nucleus here. So there's all different sizes and shapes and orientation. There's no order. There's no order. All the cells are in a free-for-all state.